Hi, welcome. Thank you for being here. I'm Ren. Right off the bat, I apologize for the video and audio quality. I'm doing the best with what I have at the moment. Maybe it'll get better in the future if people actually watch these videos, who knows. But this is just a quick introduction to the video series for the prenatal yoga classes. There's just a few things that I think are extremely important for you to know, and I'll touch on them throughout each class, but I think it's good to just have a little background knowledge. First of all, congratulations. And whether this is your first pregnancy or 10th pregnancy, um, there's always something new to learn about the way your body is changing, the way your mind is changing. And to that end, if you have an existing yoga practice, it is your new endeavor to just let it go. Let go of any expectation for what a certain shape should look like or feel like during pregnancy, and actually a significant amount of time afterwards. There's a huge surge in a hormone called relaxin. And what that does is it allows kind of like the bony structures of your body to expand and, the pelvis to broaden and to make room for the growing baby and the birthing process. It affects your whole system. So a lot of people get excited during pregnancy because in their yoga practice, they feel so flexible. But unfortunately, it can really lend to injury. It might not even be like an injury that you're aware of at the time, with the knees and the wrists and the hips and the shoulders just kind of being a little bit more lax, especially early in pregnancy. Like you have a ton of that hormone, but you don't feel super big or super pregnant yet. So you may be more inclined without even realizing it to like overstretch or overtax your joints. So just being aware of that. Our focus is going to be on stability, not flexibility. Um, I'll give you plenty of reminders throughout classes because it's easy to forget. Um, there are a lot of changes in the mind. If you're early in your pregnancy, you're experiencing that extreme fatigue that rears its ugly head back again towards the very end of pregnancy. If you're in second trimester, then bam, high five, you probably feel great. But if you're, in those early stages, it's hard to adapt to the way that your mind feels, and you can kind of sometimes feel badly about yourself or like you're feeling unmotivated or something like that. Like just let that all go. Go ahead and head into that first video about fatigue and nausea, and we'll take care of it. Don't worry. I don't think it ever really goes away. My son is one. Yeah, I think you just get used to it. You adapt. But in first trimester, for real, it's legitimate. I spent like 48 days on the couch in the beginning of my first pregnancy. Couldn't move. So, common physical complaints. There's like the big six within pregnancy. So, diastasis recti, that is the separation of the linea alba, that center fibrous tissue in the middle of like where the six-pack abs are. There's some separation for everybody. It like doesn't cause problems for everybody, but it does expand, obviously, because your abdomen is growing and stretching. So, we want to avoid pressure in the abdomen. So, if you can think of like doing like a crunch or something like that. Early in pregnancy, if you still feel like that feels okay, that's fine. But after like those first 12 weeks, we really avoid making the intra-abdominal pressure higher. So we're going to talk a lot about proper engagement of the intrinsic core. So we're going to do a lot of pelvic floor awareness, a lot of pelvic floor engagement. And then your transversus abdominis, you have four layers to your abdominal muscles, your core muscles. The transverse abs are at the very center and they sort of wrap around like a corset. And we'll learn a lot about throughout the videos, like how to engage those, because that's all that's left to kind of hold you together. The other three layers are kind of like, what's going on? And so a lot of people can get pain here, and you can even get some bulging right there. And for some people, that becomes permanent, and it creates like a permanent weakening of your core. So we really want to avoid that. So a lot of awareness around that. the round ligament. If you're further along in your pregnancy, you could be experiencing what feels like kind of like side belly pain, or sometimes even down into the hip or the front of the pelvis. SI joint, so that is the joint back here, your sacroiliac joint. So people can feel that, experience that as like pinching, or even maybe sort of reminiscent of like high sciatic pain, but not necessarily in the back of the leg. Low back pain, super common, and even around to the outside of the hip. I had like terrible piriformis pain when I was pregnant, more so later on, but it can be common at any time. A lot of pelvic floor awareness, and then sometimes people can experience like pelvic floor if you don't have that awareness or don't have some kind of physical practice where you're properly engaging. And we'll talk about proper engagement of the pelvic floor as opposed to what people kind of think is a Kegel, which is like, which is not correct. And then the pubic symphysis, so the bone right in the front of your pelvis where your two sides of your pelvis come together, very common place for pain. And the good news is for the majority of these 6 common complaints, physical complaints of pregnancy, the cues within your yoga practice are very similar, if not exactly the same. So it's just a lot of stabilizing towards the center, stabilization of the pelvis, of the spine, of the core, the activation of the pelvic floor. And we'll get into all of that. Breathing will change a lot. So once you get like really big in the center, it becomes very difficult to take deep breaths, and you just kind of feel shallow and out of breath all the time. So we'll learn a lot in the later videos about how to breathe into the upper chest, into the sides of the rib cage, and towards the back. But just as a little, precursor to that, if you can breathe in such a way that you could imagine perhaps above, if you could imagine where a bra line is, breathing above there and encircling your heart with breath. So like if I were to take my hands on the left and right side of my upper rib cage and take a deep breath in using that cue, you'd see my hands go out and in. And I'm not moving my hands on purpose, like for effect. So that's kind of a practice that we'll learn. And then most importantly, I want these to be fun. I want you to have a good time. They're going to be in various lengths and aimed at different stages of pregnancy. Anyone can do any of them at any time. Just use your judgment. And then, of course, always make sure it's okay with your doctor to participate in any kind of exercise. And I can't wait to go on this journey with you. If we ever touch on something that you want to learn more about or want to do a class specifically focused around, just let me know in the comments. And I will do my best to answer your questions and to make any additional videos. So have fun. Namaste. Peace.